What is the difference between retinol, retinal, and tretinoin? Let's talk about vitamin A and its role in our skin health. Welcome back. I'm Dr. Maria Azizian, a board-certified general surgeon and an IFM-certified functional medicine physician. Here are some interesting facts about vitamin A. Vitamin A exists in two primary forms. Preformed vitamin A, retinol, is found in animal products such as meat, fish, dairy, and there's also provitamin A or beta carotene, for example. It's found in plant-based foods such as fruits and vegetables. The body converts carotenoids into active vitamin A. A few sort of general facts. Vitamin A is essential for maintaining healthy vision. It is a component of rhodopsin, a protein in our eyes that let us see in the low light conditions. A deficiency in vitamin A can lead to night blindness. Vitamin A is important for normal functioning of our immune system as it is important and it enhances the functioning of white blood cells that are important for our immune response. Also, carotenoids, the plant form of vitamin A, act as antioxidants. They protect cells from the damage caused by free radicals, which are linked to chronic diseases and aging. Bone health is next. Adequate vitamin A levels are important for bone growth and development. However, excessive intake, particularly of preformed vitamin A, has been linked to an increased risk of fractures in older adults, highlighting an importance of a balance. Balance is always a good thing. Now let's discuss the forms of topical vitamin A and how it's used for our skin. Let's start with retinol. Retinol, a form of vitamin A, is widely used in skincare due to its ability to address various skin concerns, including aging, acne, and hyperpigmentation. There are different forms of retinol and related compounds, retinoids, that are used in skincare, and they have various potency and effects. So let's start with retinol. Retinol is the most common form of vitamin A that is used in over-the-counter skincare products. It is a milder retinoid compared to a prescription strength options. Retinol works by converting retinaldehyde and then into retinoic acid, the active form, within the skin. This process takes time, which is why retinol is less irritating and more suitable for sensitive skin compared to stronger retinoids. It also promotes collagen production, accelerates cell turnover, and helps reduce fine lines, wrinkles, acne, and uneven skin tone. Retinol is often recommended for those who are new to retinoids or with sensitive skin. It is typically applied at night as it can increase skin sensitivity to sunlight, but more about that in a few minutes. The next type of retinoids, topical product, is retinaldehyde or retinal. Retinal is a precursor to retinoic acid, and it's more potent than retinol, but less irritating than prescription retinoids. And it still has to be converted into retinoic acid, but it converts more readily. So that's why it has less side effects than prescription. And it offers benefits that are similar to retinol, but slightly stronger. So it's a slightly stronger version of retinol. It is a good option for those who have used retinol before and are looking for something a little bit stronger, just a little bit. The next product is retinoic acid or tretinoin, and that is a prescription. It is an active form of vitamin A. It's a prescription strength retinoid and is used in variety of dermatological treatments for a variety of conditions. Unlike retinol and retinal, retinoic acid doesn't need to be converted in the skin because it's already in the active form, making it more potent and effective. Tretinoin is effective for treating acne, reducing deep wrinkles, improving skin texture, and treating hyperpigmentation. Due to its potency, tretinoin can cause irritation, redness, peeling, especially when first introduced. It is usually prescribed for more severe skin concerns, and it's not suitable for everyone without guidance from a medical provider. It is important to counsel patients before initiating treatment with topical retinoids in general. Patients should be informed about local skin irritation that could be part of this treatment. And skin irritation, again, I'm repeating myself, redness, stinging, dryness, peeling, they're common side effects of topical retinoids. And they often result in patient noncompliance because of that. Adverse effects are more likely to peak at 2 weeks, and then actually they decrease with time. So it does get better. Regular application of moisturizers is helpful in reducing this irritation from topical retinoids. Some practical notes. Topical tretinoin should be applied sparingly, very thin layer, no need to pile it on. It is started at the lowest dose to minimize adverse effects and to increase patient compliance. So commonly a topical tretinoin of 0.02 or 0.025% is used. It started every other day in people with sensitive skin or every evening with a normal skin. It is always recommended to use it at nighttime. Why at nighttime? Several factors. Increased sensitivity to sunlight. Tretinoin increases the skin sensitivity to UV light, which can lead to higher risk of sunburn and skin damage when exposed to sunlight. By applying it at night, you reduce the chance of sun exposure during the time that medication is the most active on your skin since you're sleeping. Another factor is that tretinoin can degrade when exposed to sunlight, reducing its effectiveness. So nighttime application ensures that it can work effectively without being broken down too soon by the UV light. There's also better absorption at night as your skin is in a state of repair and regeneration, and there is less environmental exposure to factors like pollutants or makeup that may interfere with tretinoin absorption. That makes nighttime an ideal period for applying tretinoin to maximize its absorption and efficacy. Another factor that justifies the night usage is layering with other products. At nighttime application allows tretinoin to be the final step in your skincare routine. Typically after cleansing and moisturizing, this layering helps ensure that tretinoin is the primary active ingredient on your skin and nothing else is interfering with its absorption. So that's an important factor as well. A few considerations for patients with sensitive skin. Instead of every other day, they may even start it with a twice a week regimen for the first few weeks and then increase the frequency of application gradually. In general, topical tretinoin concentration and frequency of this application may be gradually increased over several weeks as tolerated by the patient, up to daily application of 0.1% of tretinoin. However, higher concentrations may not correlate with better results. As an example, 0.1% of topical tretinoin is considerably more irritating than 0.025, and it may not add additional benefits. So when would you see the effects? Topical tretinoin should be tried for a minimum of 4 months because benefits may not be appreciated before then. So it may take 4 months. Unfortunately, the benefits of topical tretinoin are lost upon discontinuation. Although it has been studied for a duration of 2 years, it may be continued for a long time, such as for several years. A long-term maintenance regimen with a lower concentration or less frequent application may be a way to sustain the benefits without the unpleasant side effects. Finally, treatment with topical retinoids in general should not be started or continued during pregnancy because retinoids in general are known to be teratogens, meaning they can cause fetal malformations, although there is no direct evidence that topical retinoids cause congenital malformations. Even topical retinoids are not recommended during pregnancy. And that's a little bit about retinol, retinal, and tretinoin. Thank you so much for listening. Until next time. Bye-bye.